Hi, good afternoon. My name is Janet D'Souza, and I'm going to be talking about the most beautiful journey of our life, pregnancy. I'm going to start it in a while now. Stay tuned. So that's pregnancy. Now about the internal anatomy. The fallopian tube, the ovary, uterus, cervix, vagina, the hymen. And that'll be the external part of the anatomy of the female reproductive system. And yeah, so the external genitalia is what we've not shown, but we know it's got the labia majora and the minora, the clitoris, the perineal body, and the internal genitalia, as I just showed, consists of the vagina, the cervix, fallopian tubes, uterus, and ovaries. Now, females by and large have an increased risk of upper urinary tract infection, which is due to the close proximity of all the internal organs with the external environment. Because of this proximity, we tend to have more urinary infections than men do. Now, pregnancy. We all know that pregnancy begins with a fertilized egg. That is when the sperm meets the ovum. The lining of the uterus is when you get the fertilized egg. And that is how the normal pregnancy should be. But in some cases, an ectopic pregnancy occurs. And this happens when the fertilized egg or the zygote, which is, it grows outside the uterus, sometimes on the fallopian tubes. And this type of ectopic pregnancy is called a tubal pregnancy. Sometimes it can also occur in other parts of the body, not alone on the fallopian tubes, but also in the ovary or the abdominal cavity, which connects to the vagina. So we can have even such circumstances of ectopic pregnancy. And these pregnancies, they do not proceed normally. Why don't they proceed normally? Because number one, the position. Number two, how is in genuine cases, just imagine, how can you have a fully grown fetus, within the fallopian tube or somewhere outside the uterus, which is supposed to be hoisting or keeping in the fetus and all the development that is to be taking place. And if this happens outside, and if the ectopic pregnancy doesn't proceed normally, fertilized egg doesn't survive. And what happens then? Bleeding. And sometimes it can be life-threatening. That is, of course, if there is excessive bleeding. Now, see, like I explained, this is a normal pregnancy that I'm pointing out at. If you see this structure of the internal reproductive system, here is the fallopian tube, and this is where the egg gets implanted in case of an ectopic pregnancy, but in a normal pregnancy, it gets implanted here, close to the uterus, in the uterus. This is where it's supposed to be normally taking place. But in ectopic pregnancy, look, this is exactly where the fertilized egg is implanted. Now, if it implants her, imagine it growing and growing and growing. Have a baby outside the fallopian tube? No, it doesn't work that way, right? So it has to have that embryonic field, that the nutritions that it requires from the amniotic fluid, or all this is here in the uterus. In a healthy pregnancy, the fertilized egg attaches itself to the lining of the uterus that we saw. In an ectopic pregnancy, the egg attaches itself somewhere outside the uterus, mostly the fallopian tube. The most important, what are the symptoms? Like I said, bleeding, unusual bleeding, the first warning signs. Pelvic pain, because it harbors the uterus, right? The pelvis harbors the uterus, so you will be having pelvic pain. If blood leaks from the fallopian tube, you might have shoulder pain. This is quite unusual. Why shoulder pain? Shoulder pain, this is called the referred pain, or the referred pain, as you may will. Now, the referred pain is usually that pain which is taken by the nerves from the uterus, and they can travel all the way up to the shoulder, and thus you will have shoulder pain. So this is a classic sign which indicates that we are having a problem. Bleeding, pain in the shoulder. If you have an urge to go to the washroom every now and then, for bowel movements, this is really not very ordinary. This is something wrong that's happening in your system, and you have to go and see the doctor ASAP. It's one of the red flags. Now, the emergency symptoms will be if there is a heavy rupture, if there is too much of bleeding, if there is too much of bloating of the abdomen because of extra bleeding that is taking place inside. Seek emergency medical help, which we must do. Like I said, if that's a red flag, then we need this, because severe abdominal or pelvic pain, which is accompanied by vaginal bleeding, not good. Extreme lightheadedness or fainting. Why? Because of blood loss. Shoulder pain, referred pain. Now, what are the causes? The causes can be so many. Either there is already an implantation, which is called the IUD, the intrauterine device, which is inserted in the reproductive organs so as to control birth. If you do not want too many babies and accidentally you get pregnant, that could happen. Like, the IUD is there, so where am I going to get implanted? So it has to go and get implanted somewhere. So fallopian tube is the choice of the growing embryo at this point of time. Or if the movement of the egg is blocked or slowed through the tubes, it can lead to ectopic pregnancy. Now, why can this happen? Maybe because of some polycystic ovaries, maybe, or even could be due to some tumor that is not known. Sometimes you just don't know, but you have a tumor. So this could be another reason that the implantation takes place in another place instead of getting implanted in the ovary, in the uterus. And these symptoms or the risk factors are usually seen with women who are over 35. They have sexually transmitted infection, smoke cigarettes. Smoking cigarettes is really supposed to be very, very bad for the body, especially when you're pregnant. Drinking alcohol, recent IVF treatments, having scarring from the pelvic surgery, like wherein, keloids haven't been formed, or wherein the process of healing is still taking place and there is thickened tissue already. Had a previous ectopic pregnancy, tried to have tubal ligation, that is tubes tied, or the reversal to not have pregnancy again. So these are some of the causes. Complications. During an ectopic pregnancy, the fertilized egg is wrapped in a structure that can grow for several weeks outside your uterus, but the structure usually bursts between 6 to 16 weeks. Now, this ruptured pregnancy causes bleeding, unstoppable bleeding, because of which you have a hemorrhagic shock and the odds of dying from it increases. If it is treated before it bursts, you can survive. So, which is why red flag, immediate medical attention is sought. If the structure doesn't burst, it can damage the fallopian tubes. And if the fallopian tubes by accident, if they're removed during surgery, or not next to impossible, but impossible to get pregnant again. You will have fertility issues because we need the fallopian tubes. Ectopic pregnancy diagnosis. So this is done with the help of course, we have ultrasounds, we have pelvic examinations, we have pregnancy tests. Now, the ultrasound, it's a non-invasive test which uses sound waves, the word ultrasound, right? So it uses sound waves which are high frequency, and the test is performed by a sonographer and may be done transvaginally or transabdominally. Usually transvaginally when it is the initial weeks of pregnancy, or otherwise mostly it's done transabdominally. During the ultrasound, the doctor looks for the presence of gestational sac, the location, and whether there is a fetal heartbeat. So this will tell us if the fetal is still alive or if the fetus has already died and is just there. It's just sitting there. Treatment. We have methotrexate, or also called the Trexol. You'll only need 1 dose of this injection. It stops the fertilized egg from growing. Your body will absorb the egg in about 4 to 6 weeks. And with this treatment, you do not have to remove the fallopian tube, which means you can, if needed, you can get pregnant again. You run a few blood tests to measure your HCG, which is a very important hormone called the human chorionic gonadotropin. Now, this is very important hormone because if your body makes this, it detects pregnancy. And you won't be able to take this medicine, the Trexol or the methotrexate, if you're breastfeeding or if you have certain health problems. So we have to consult with the doctor before taking this, because in some countries this is available over the counter. So be very, very specific and consult your doctor. Surgery. In most cases, you need a surgery. And the most common surgery that we have is a laparoscopy. The doctor makes very small cuts in your lower belly, inserts a thin flexible tube called the laparoscope to remove the ectopic pregnancy. If the fallopian tube is damaged, you may have to remove that as well. You cannot have a damaged cell sitting in your body because that can cause some other problems, and we want to avoid as many problems as we can. And this would be called laparotomy. What are the hormonal influences? Now, this is very, very important. We all know the most important hormones we have for females are the progesterone and the estrogen. Now, when the progesterone levels in the bloodstream rise very early, this is normal in pregnancy. But if the levels are low, lower than what it is supposed to be or lower than usual, we know this is not the right sort of pregnancy. It's not heading in the right direction. So this is an ectopic pregnancy or something which is an impending miscarriage. And the main function of progesterone, as we all know, is to prepare the endometrium, which is the lining of the uterus, for a fertilized egg to implant and grow, for the baby to grow. Precisely. Hence, in this case, it doesn't function well, and the result is an ectopic pregnancy. Now, a very high estrogen to progesterone ratio, that is a high concentration of estrogens and a low progesterone concentration, causes ectopic pregnancy as well. So we have to get all this tested before we know we are going to consume or before we are heading towards getting pregnant. Because high estrogen, we know estrogen is for contractions of the uterus during pregnancy. Now, you do not want a high estrogen level while you're pregnant. So if while you're pregnant you have this, then chances of abortion are more, chances of a miscarriage are more. So this ratio has to be within limits. You cannot just have it increasing at any point of time. Therefore, in ectopic pregnancy, this ratio is altered, and high levels of estrogen cause continuous development of the egg and it terminates pregnancy. Simple as that. It'll just terminate pregnancy, and we really do not want pregnancy to be terminated. If you really want to be a mother or a father, we have to take care. So in short here, friends, we have to make educated choices before we get pregnant. During pregnancy also, it just doesn't end till you get pregnant. It also continues during the course of pregnancy. Exercise well, get enough oxygen to your tissues, to your skeletal tissues, avoid varicosity, avoid varicose veins, avoid anything that is not healthy. Pregnancy, by and large itself, is a beautiful journey. So just make educated choices and do not kill it with negligence. Do not kill it with stupidity, as in you think you know everything, but you do not know. The doctors know best. Consult the doctors, consult your caregivers, and they'll be the best to tell you if this pregnancy is heading the right way. Not only important for your health, but important for the health of the growing fetus as well. With this, I end this lecture. Hopefully you guys liked it. So thank you very much.